Boston researchers may be closer to identifying why some COVID-19 patients experience symptoms for months or even years after an infection. Here to explain, Dr. Daniel Koritzkis, the chief of infectious diseases at Brigham and Women's Hospital. Dr. Koritzkis, good to see you.
Good to see you, Erica and Ben.
Yeah, thanks for being here, Doctor. So your colleagues at the Brigham, Mass General, they've been looking at possible causes, we understand, for long COVID. So what clues have been found so far, if any?
Well, this paper looked at, or this preprint, it's not yet peer-reviewed, looked at about 37 people with long COVID and around 25 or so people who had recovered from COVID. And they found in the long COVID patients, there was persistence of the spike protein detectable in blood. That's quite interesting because it suggests there might be some source of that protein, like ongoing virus replication, even months afterwards. It's very preliminary, needs to be confirmed in larger numbers, and the proof of the pudding would be if treating those people with an antiviral like Paxlovid reduced that level of spike protein and caused symptoms to resolve, that would really nail it.
Well, you've talked with a lot of COVID patients whose symptoms seem to linger, so what do you tell them?
We say that we know that many people will have symptoms that persist after viral infections, that they almost always get better over time. It's hard to know exactly how long it may take for people to improve, but that the vast majority of people will get better.
Well, that's good. There's been a lot of talk lately, Dr. Koritzkis, about these reinfections. As you know, the newest variants, BA4, BA5, there are a lot of folks out there who they're testing positive for a second, maybe even third time. In your experience, does the risk for developing long COVID increase or decrease with each infection?
That's not clear yet. There's been some talk that perhaps it does increase, but I haven't seen any firm evidence that such is the case. And many people, not everybody, but many people, when they have a second infection, because they have some pre-existing immunity, either from their old infection or from vaccination, and both, will have less severe infection the second time around. So I think we just need more data on that point.
All right, so brace yourself, everybody, but there is another Omicron subvariant out there. It's called BA275. That apparently has now been detected in at least 10 countries, including here in the U.S. All right, Dr. Koritzkis, this is the big question. Why should we care?
Well, the reason to care is that we know that these subvariants of Omicron have been replacing one another as each new variant is a little bit better at escaping from immune control. The question that's not clear yet is, will BA275 now displace BA5 and become not only the predominant variant in the United States, but will it actually lead to a surge? I think it's unlikely to lead to a surge because we haven't seen BA5 cause a surge so much as stagnation. But we've been so bad at predicting things so far in this pandemic that I think we'll just have to wait and see what happens.
But I guess to follow up quickly, Dr. Koritzkis, is there any really big difference between all these subvariants besides the fact that one might be slightly more contagious than the other?
Well, actually, if you compare the sequences from these different Omicron subvariants, they are quite different from each other, almost as different as Alpha and Delta were from one another, but they're still so different from all the others that they still count as Omicron.
Oh, interesting.
Okay, well, to be continued.
Yes, thank
as
you,
always.
Dr. Koritzkis.
Thank you, Dr. Koritzkis, for joining us. As always, to our viewers, if you have questions that you'd like our experts to answer, email them to ask@wcvb.com.